Yeah, and okay. Our speaker today, I'm just going to introduce Mr. Ayo Arigbabu, a graduate of the Obafemi Awolowo University, Nigeria. Did part of his internship, did his internship at the Lagos University Teaching Hospital, that's LUT, Idiaraba. And after some years of practice, which included as a lecturer at the Obafemi Awolowo University, Nigeria, he moved to the United Kingdom, where he completed Masters in Collaborative Healthcare at the University of Salford in the UK, and with a Sub-Saharan African Scholarship Award, part funding. He also recently obtained Masters in Advanced Clinical Practice from the London South Bank University with a merit, and that was also funded by the Health Education England. Mr. Arigbabu has completed several CPDs, including Bobat Concepts and Society of Musculoskeletal Medicine courses. He currently holds the position of physiotherapy lead. And I have to say, he has been of immense support to the physiotherapy community, particularly in the United Kingdom. He represented the profession on the panel of judges during the NHS at 70 award, organized by the Nigerian Healthcare Professionals United Kingdom. He has supported with his expertise in IT, developed many of the landing sites in our various activities. I have the pleasure of introducing to the seminar Mr. Ayo Arigbabu. Thank you.
Thank you, Dr. Ademola. Really appreciate that introduction. Yeah, first of all, let me use this opportunity to welcome everyone again to this webinar. Like I said earlier on, it's a webinar that's been organized by Nigerian Physiotherapy in UK. And the essence of this webinar is actually to help to share information with our colleagues that are getting into the system, and probably for other people as well. They might find the information really useful for them as well in their career in UK. I'm going to start sharing my screen with you so that we know where we are. Just to check, can you all see my screen at all? Because I can't see myself again now. Can you see my screen at all? Can I have yes?
No, not yet. Not yet.
Okay.
I think something is coming up.
Oh, okay. Let me go back then. Is anything showing now?
It's not coming up on this side yet.
Okay.
I think underneath, taking it from the speaker coming into the video, I'm saying on the tabs underneath, the green section that yes.
Okay.
I think yeah,
we
have
yeah.
it now. Yeah.
Okay, then. Thank you.
If you want to, it can be bolder with the yes.
All right. Okay, thank you. The title of our webinar is actually on breaking barriers and navigating challenges and opportunities for Nigerian physiotherapy in United Kingdom. So it's just to take us through a few of the challenges and opportunities for us as physiotherapy in United Kingdom. I'm going to start, first of all, with the challenges that is being encounter all over the world in terms of healthcare professionals. According to estimation of World Health Organization, is actually estimated that by 2030, there's going to be shortfalls of about 15 millions of health workers globally. This is a big challenge. And NHS is not excluded from this. So it's a problem, it's a global issue. And in United Kingdom, but this is where we're going to be focusing on this seminar, is that the challenges of the shortage of workforce arose, or they actually emanate from various reasons. The major one is actually the retention of staff and recruitment of staff. We have high usage of the health facilities by the aging population, because when you look at United Kingdom, the aging population are increasing. When you look at people going to A&E, you'll discover that they are the elderly going there. And this can be easily understood in the sense that they do have more of this comorbidity, which will lead to the admission or presentation in a care hospital or in the A&Es. We also have the issue of Brexit as well, because we know that United Kingdom is actually out of EU, and some of the health workers that will have come from EUs probably don't have that free movement like they used to have. We also have the issue of health inequalities as well. And more recently, the pandemic has actually added to the problem. So we have backlogs in the system. What are the impacts of the foreshots or this low workforce capacity in the system? Number one, which I know some of us, if we're already working within the system, will have been experiencing it, is the increased workload. The vacancies are there. Unfortunately, they have not been able to fill them up. So, and where we have less people on ground to do the work, however, the workforce, the workload is not changing, then there's a chances that in some situations we'll have quality of the care being affected. And I think if we remember this Staffordshire scandal, it was one of the issues that came up in the inquiry then, that the staffing was an issue. Another impact of low workforce is waiting time. You know, when you go to A&E, when quite a lot of people are there, you have to stay there for a longer time. You have an operation to do, you'll be on the waiting list for elective surgery. That will take a longer period of time as well. So they will have impact on the access to the healthcare for the people. So it's affecting the whole nation as well. Not only that, the cost of providing the care is going to go up in the sense that the establishment or the trust or private organization, they have to depend on agencies, staff, you know, to cover the shifts. And in some situations, it can actually lead to delay in the treatment that the patient will have, which can actually cause more in terms of, you know, the intervention they're going to receive. One other major factor is, or the impact is that this can actually have impact on the workers that are actually doing the work at the moment, because if you have so much to do, then you probably will be put under stress. And this can lead to burnout. And we have stories in the news where GPs are leaving, even some therapists and nurses, because of the burnout. And this could lead to, you know, high rate of turnout. Where staff are very limited, then there will be limited time to engage in, you know, innovations or doing other things. In 2019, this has got nothing to do with international recruitment, but in 2019, the healthcare leaders in NHS, they came together and produced a document which was titled NHS Long-Term Plan. And they look at different things in that plan. One of the areas they look at is the workforce. And they were looking at what could they do or what can be done to improve on the workforce. And they look at the strategies on the retention of staff, the recruitment ways, looking at better working conditions for staffs, giving opportunities for career development as well. And this actually led to creation of more jobs as well within the systems. And one thing that's actually happened more recently, which was actually contained in that document, is that they're looking at increasing and giving opportunities for the existing staff as well to be able to expand their scope and their roles as well and the skills, which will give them opportunity to progress as well in their job, in their career. They also focus on trainings and education of staff within the system. And we have seen maybe where some apprenticeship program are being rolled out in where you're working. Another thing is actually collaboration, which they call an integrated care system, being looked at, how people can work together, professionals can work together, organizations can work together and have better communication and coordination of the service as well. More recently, we've been seeing technologies coming in, and we've been seeing telehealth, and more recently, AI is coming in as well. They also look at workforces themselves. How can they be taken care of, looking at the well-being. So these are the areas they look at in the NHS long-term plan, which was published in 2019. That was before COVID started. That was in January. In spite of what they've done, there's a big gap. And these have resulted in international recruitment, which we'll have seen. And some of us probably have come in as well through that avenue. This data was actually gotten from government website, and this shows the nationalities of NHS workers. This was done in 2022, June 2022, and it shows different nationalities of workers within NHS. And if you can look at it, you can see Nigeria being number 4 there. And actually, I'm not sure, but I'm just speculating that some of these nationals will have been nationalized, become British, and that figures might have moved into where you have the British number going up. Another data that I looked at is on PC, and the SCPC record shows that more Nigerians actually coming in. Though between 2018 and 20, it shows that Nigerian is about number 6 on the list. However, post-Brexit, the figures of Nigerian coming through have increased, are registering, with HCPC. So Nigerian and Indian actually, going high in the number of people enrolling or registering with HCPC. What are the factors? I'm not going to do it here because we all know the reason why we're here. Some of the reason why people migrate to United Kingdom, most especially the health workers, is better pay, might be because of opportunity for further studies, which some people will have come in to do their masters or for PhD, and from there they stay behind, maybe because something happened in the process of staying. Some people actually came in because they want to gain experience as well. And so for other people, it might just be because of the fact they want to have better opportunity in their career so that they can progress a bit further. And so for some, it's probably might be because they want to go into research, because the country where we're coming from, there might not be enough funding for people working in the academic sectors or in the research area. So there might be better funding here, so which will help them in their career, if that's what they're choosing to be. And some people will have gone in because of postgraduate studies. And we know the situation in the country as well. Political stability or economic issues and insecurity might be for the other people as well. And so for some other people, is to look for better life as well for their children, good education and exposure. So we have different reasons. However, once we're all here, there are different routes and pathways. These pathways actually just put it together myself. It might not just be something that is out there, but I just put it together. I said, some people go through the academic pathway, career pathway. We have some, like us, we've decided to go into clinical career pathway. And we have some that went into the business, entrepreneurial career pathways. For people in the education, you can go through the course of lecturer, senior lecturer, and become a professor and all the rest. In the clinical setting, you can be, clinician all through. And the good thing with the United Kingdom is that they actually try to encourage what they call like clinical clinicians or clinical academics clinicians as well, which give opportunity for clinicians that want to go into research. That opportunity is actually there. And this is funded through what's it called, Health Education England. So people just have to be aware what is actually out there, not just only clinic, stay in the clinics, but there are other opportunities out there as well. If you still want to be in the clinical area, but you want to go more, have a bit of the mixtures. And people go into private practice or independent practitioners. I got this data from CSB website, and this just shows the distribution of workplace for all the therapists. And as you would expect, majority of the physiotherapists are actually practicing in NHS. I think the second highest place where people are working is like self-employed or in the business. And the third one is in higher institution. This data actually was got it from CSP website as well. And it just shows the reason why what people put forward as one of the reasons why they find it difficult to secure their first physiotherapy job in United Kingdom. And one of the first or the leading factors is actually a lack of UK experience. And I know I faced the same thing when I first arrived in United Kingdom. And I think some of us will have, experienced it. But maybe things have changed now where, they're looking for staff to come and help out in the system to work with the patients. Here, I'm not going to dwell too much on this one, but these are just a few of the things we can look at if one is actually just looking for their first job as a physiotherapist in the United Kingdom. We all know we just have to have our HCPC registration. One thing I would say is really important is to have a goal, what you want to do. Like we mentioned, different pathways that are available for people to pursue. You just have to establish your own goal. What do you want to do? Am I going into academics? Am I going into private practice? Am I going to go for money and join an agency and work like a locum and make a lot of money there? So you have to decide what you want to do. And once you've decided that, then you start looking. But our advice when you're looking for a job, always look for a workplace where there's a good opportunity for development, where they talk about so many things. That is, if you are looking for your first job as a physiotherapist in the United Kingdom, look for a workplace where they have preceptorship, where they can provide clinical support for you in terms of supervision, professional supervision, and many other, support for you when you're just joining a new system where you know nothing about that much. You might be very sound as a physiotherapist, as a clinician, but you come into a new system. So you need that support at the initial stage. And ensure that during the stage where you're preparing for your submission of your forms, look at the job description and the person specification as well. Look at how you can address the points that they've actually highlighted in there and how you've met those things. And give an example in your further information. There's a section there where there's your further information. Ensure that you can actually demonstrate how you've made those job description and the specs that have been put in there. On the day of the interview, ensure that you sell yourself. Tell them what you are made of what values you can bring to them. It's not just that you're looking for the job, but you have got something to offer. They are looking for people that will come into the team to offer something in the team. So you got to be looking at how you can sell yourself. That is if you're just looking for your first job as a physiotherapist in the United Kingdom. And the other thing I would say is that peradventure, one is not successful in the interview, you have every right to ask for feedback. And that will help you in preparing for your next interview as well. Once you've got your job, your first job in the United Kingdom, this is one of the things you might face. And I think It's expected for us to face this. We call it imposter syndrome. And this might even be more prominent if you've not practiced that very much. Let's say you've been in private practice and you haven't been in much contact with that much patient before coming over. You probably will doubt yourself a little bit. And the expectation you'll be, so I'm coming into this environment, the expectation might be quite high. And you might feel, I might really, a therapist myself. This is how the self-doubt can actually come in as well. When you compare yourself with the locals as well, the professionals that you meet at workplace, you probably might say, oh, these people are really, really experienced. They got the knowledge. I'm not as good as them. So that can actually bring some issues with imposter syndrome. And for some, they might have gone through a very difficult time during their registration with ACPC, and they have a tough time. And that's going to lead to a situation where someone might feel, am I really who I say I am as a physiotherapist? And then the fear of making mistakes can be another issue as well. You might be afraid of making mistakes because of the fact that you're not familiar with the process, the system you have just joined. So that fear might come in and want to cause the issue. However, we've got to be looking at how we can overcome these challenges of this imposter syndrome.
I'm very sorry, Mr. Ribabu, please. Just to say, can we please all mute our devices? Because we are having a lot of background noise, please. Thank you. Sorry.
Okay, thank you.
Can carry on.
So when we find ourselves in this state, in this state or in this situation, we got to remember that we've gone through a tough system before we come over. We came over to United Kingdom. We are here because we've gone through a lot. We've been to university system. You have completed your program. So you should have that belief that you have achieved it. Nobody has done it for you. So that should give you a kind of encouragement as well. The other thing we got to look at is probably we need to be looking at self-reflection as well. What is bringing this doubt on me? What is giving me this feeling, the way I'm feeling at this present moment? So having a self-reflection and having a view of self-awareness is really important so that you can actually assess things more objectively and see how you can deal with it. And you got to be more compassionate. Nobody will come and do it for you. You got to have a view of self-compassion upon yourself. You come into a new system. A study was actually carried out, and this was done in Canada. It hasn't got to anything to do with the United Kingdom. However, we can draw some lessons from this study. And the study was actually conducted among healthcare professionals that relocated to Canada. I think physiotherapy, pharmacists, physicians were all interviewed, and the survey shows that the area where people have issues with is communication, especially the foreign trained professionals. And being able to do our job, we need to be able to communicate. We are in a system where you're going to talk with your colleagues. You are going to be in a system where you're going to speak with a nurse. You're going to talk with a doctor, a consultant. So we need to build that confidence. However, this is what the studies is actually showing. I'm just going by what the study is actually telling us. And what they found out in that study is actually that there are two professions that is very prominent among. It's actually physiotherapy and pharmacy. And they discovered that this is more common in the country where they have less autonomy. And it seems like autonomy has a very big factors in this area. Having a confidence is very important for us to be able to communicate, because you cannot work as a person alone. Some of the patients you're going to see, if you're working in an inpatient environment, you discover that you got to work with team and you got to work together. And if you cannot communicate with your colleagues, then it's going to be an issue. So having that is very important. Having the confidence, building that confidence is very, very important to be able to communicate with others. Another study was actually done by Kaplan and Kaplan 2013. And what they say is that for foreign trained therapists, this is more focused on therapists and not all the professions. And what they said is that we can boost our confidence by depending and trying to reflect and thinking about our own unique perspective you bring to the table, the experience you've got, you have got something to offer, and you're going to be working in a very ethnically diverse environment. UK is very diverse. If you work in England, for example, London, you're going to meet different ethnicity. So you've got something as a professional to offer. And most of the workplaces as well, they have policies around equality, diversity, and inclusion workplace. So you've got something to offer as well in that respect as well. In my own organization, they have what they call like a Black, Asian, minority, ethnicity group. And with CSP as well as the Chartered Society of Physiotherapy, they have groups for this. So participation in this will probably help you to develop your confidence, will help you to develop your, establish yourself as well, you know, and contribute to your organization in that area. And once you've been able to do one thing in one area, it gives you more confidence to go into other things. And the good thing about this is that you're going to interact with other people from other departments, from other services, but from your own, you know, group. And you have mentorship and all the rest facilities or support in this kind of group. So now we encourage, if you're working in an organization, I have never joined them before. However, recently I've joined them and I know they've got so much value to offer. So this is one of the things I would recommend if you're working in any organization and they have something like this, try to join. The other thing we got to be looking at is that especially for first timers that's just joined the job, you probably might have worked for 5 years. You've got a lot of experience in the clinical setting where you're coming from. However, working in a new system, sorry, I think we need some people to help us just to mute their speakers because we can hear some background noise. All right.
Sorry, I'm sorry. You are the host now. You might be able to just mute any. Yeah.
But I get a go ahead.
Sorry for this time. I'm just trying to mute everybody that is probably having a speaker on because it's causing an issue here. Okay. Like I was saying, we need to develop our confidence for us to be able to practice. If we're just joining, I mean, we're just moving into our first role in United Kingdom. For some, they probably will have a lot of years experience as a clinician. Some probably will have 5, 10 years experience before coming over. And we got to be very careful because you're coming into a new system. Your clinical experience, nobody can doubt that. However, there's few processes, there's few things like legal frameworks that you got to remember, you got to be working within, and you got to be cognizant of this while you're doing your work as well, so that we don't let that fact that I've been doing this just for ages, then at the early stage, we just think we can jump into it. You can do your clinical work. However, there will be other processes that you probably need to ask other people if you are not sure. And it actually explained that people will overestimate their capacity, their ability when they are facing a very complex task. Understand? So we got to be aware of this.
I'm using this, so don't bother with that.
The company filed a case, and now I'm unemployed.
Last week you were reported for assaulting a girl.
And this is just a graph to show us what it's been described by Krunger's effects. At the early stage, people might say they have the confidence because, like I said, year of experience. However, because of the fact that they've come into new systems, they haven't got the knowledge to be able to, the knowledge of the new environment, the processes might be issue there. But eventually down the line, we're going to be an expert in it, What are the challenges that people might encounter? I think some of them have been mentioned earlier on. One is feeling like an outsider in your new role, your new place of work. And you probably by your own, you have been working in a kind of almost community environment where everybody gather together, chat together during breaks, whatever, which does happen, but it's just that probably things will change a little bit because people expect you to be doing your work, so you might feel you're outsiders. Coming into a new country, you got to learn a few things as well. Orientation, do you have enough orientation when you just join this course or wherever you're working? They give you enough orientation into the new system you're joining. That could be a pretty challenge on its own. Did you have, are you having inconsistent support at workplace as well? That could be a challenge on its own as well. One of the things is the cultural competency, where you're coming from is actually different, where we are now. And I'm going to be discussing that a little bit. And lack of mentorship can be another problem that we can face during the initial stage of joining or during transition into it. Sometimes it's been reported as well that discrimination in workplace and the communication barrier can be an issue. Maybe with your patient, you've seen your patient, and I'll give an instance. There was a patient I was saying when I first arrived, not the first place of job I worked, but the second place I working in outpatient, day hospital actually. And patient told me actually wanted to go and spend penny. So why are you telling me we want to spend penny? And she said it about 2 or 3 times. Then eventually she actually said in normal English, I actually want to use the ladies. Before I could realize that's what it meant. And since then, I thought, all right, people say I want to spend penny. I know that this is what it meant. So little language that we probably would take for granted. We say, oh yeah, I can speak English. However, there are other things that we don't understand as well. Other challenges could be, family responsibility, and where you're working, there's issue with getting flexible working. You're just starting, being able to come out and ask, oh, I got childcare issues, I got this, how am I going to do it? So you stay back, and that could be a challenge on its own as well. So that's one of the issues that people might face as well. Another thing is actually, roles uncertainty. People might not be really clear what their role is. However, for you to be sure of what you are supposed to do, I think it will be much better for us to go back to our job description, read it thoroughly, understand what is actually expected of us to do. The other thing is actually the technology and equipment that we're going to be using. Some of those might be seeing some of the equipment for the first time, and it can actually be a challenge if you've not been trained or not been shown how to use it. So, and I would say don't shy at all. If you're seeing equipment being used for the first time as a new person in the new system, ask, because it's much better to ask them to cause, injury to yourself or to other people as well. And the other issue is actually the lack of, senior support where they are. They haven't got the right support. And this is a big problem, when you're working as a new staff, new in the new environment, and you haven't got the right support, then it's really going to be really difficult for you to move on quite easily in that job. Another issue is immigration status. If you're steady and you're stable, everything is stabilized for you, you can switch your job if it's not working for you. But for someone that's coming through sponsorship, then you want to stay there to ensure that you stabilize yourself and move on before you move on. So that could be a challenge on its own as well. Like I said earlier on, we're going to be talking about cultural competency. And the reason I'm saying is that you're going to come across different, the mere fact you're here, you're going to be seeing people that are different from your cultural background, your own ethnic background. In addition to that, you're going to meet other people as well. from other countries that you're going to be treating. So being culturally aware is very important in a role as because it will enable us to be able to well and to deliver effective care for our patients that we're going to be looking after. And a study actually said, that's a study by Lee et al. Mentioned that physiotherapists, we need to acknowledge our own cultural biases. So if we are aware of our own biases, then we should be able to address it as well and should not allow it to influence our care when we provide care for our patients. And when we're talking about diversity, you know, we have different diversity. You have, you know, religious, you have age. So there's so many things you got to look at as well. So you got to be mindful of this when you're giving your service. But how can we acquire cultural competency? One, we got to learn. We got to be willing to learn, whether from observing what is going on around us and even taking active process to do this. We can actually even engage in networking with other peoples from other background, from our own background. If there's any orientation program where you're working, try to participate in it and ensure that you draw the maximum from that kind of program and network with other people as well there. Reflection is very important as a therapist, as a professional. We got to be reflecting daily, not only on cultural things, even on a day-by-day activity. What has happened today in my workplace of work? What can I take from there? What can I do better? What have I done wrong? Is that a better way to do it? And like I said earlier on, willingness should be there. Scope of practice. When we come, we need to ensure that we practice safely, operate within our scope of practice. And we should be guided by this principle, this ethical principle, autonomy. That is the autonomy of the person you're actually attending to, your patient. They are a competent person. So as a professional, we have duty to educate them so that they understand what they actually we're going to be offering them in terms of treatment and the benefits and the risk that is associated with it. And we got to recognize that some people might not have the ability to make a decision for them. There's a process to follow as well for that. So that autonomy we need to recognize is why we're doing it. So this is one of the principles we got to be aware of. Then non-manipulence is a situation where you don't want to cause harm to your patient. So everything we do has to be done in such a way that we're not causing harm to patient. We want to risk assess your treatment, your intervention, anything you're doing, try to risk assess as well while you're doing your work. And beneficence as well, that we got to try to ensure that all we're doing is going to be for the good of the patient, not going to cause harm to the patient. Everything has to be good for the good of the patient. I've got to look at the patients as well. Sorry, we got to look at justice as well. So you got to be fair and ensure that you treat everybody equally. Oh, let me go back to this. This picture you can see on this slide is actually taken from CSP website, and it talks about the scope of practice as a professional. Physiotherapy is a profession that is actually has a scope, which is defined by Shattered as well. And within the scope, you've got to ensure that you're working within your scope. But the good thing in UK is that you can actually expand your scope of practice. And there's some things you got to observe to ensure that you do it safely. As you can see here, as an individual, you have your scope. Being a newly qualified, we're not newly qualified, but you have your own scope. You have your own scope that you got to ensure that you're working within your own scope, your knowledge and your skills. And sometimes also we can expand, like I said earlier on, expand our scope or extend our scope, but you got to do it in such a way that is safe. Doing it, I just make a reference to this matrix, which is they call it a status matrix. And this is a tool which is used in the field of management and organization. What Tracy's matrix look at is it looks at you understanding the situation. When you have a better understanding of the situation you want to go into, you've got to understand the dynamics of this as well. So if you're moving into a new, or you're trying to expand your scope, you've got to be, sure of what you're moving onto. You've got to be very sure of where you are as well. So establishing your goals of what you want to achieve, and be able to identify what they call like certainty, what are predictable in what you want to engage yourself in, what are the uncertainties as well, what are the level of agreement, because you're not going to do it by yourself. Let's say you work in an organization, you've got your managers that have to agree to what you want to do. And whatever you want to do has to be incorporated in your job description as well. So there will be a level of agreement as well. So this has to be balanced out while you're looking into expanding your scope. And this Tracy status matrix look into it. It looks at something that's just simple thing, a new fields you're going into, a new scope or a new skills you want to acquire, which is just simple. It might just be following some protocols. And some may be very complicated, which will require you to go for further education or working and collaborating with experts in that particular field. And some of those tasks or the skills you want to achieve as well might be very complex, which would not only meaning that you got to acquire the knowledge, get the skills and the practical skills as well, but you got to keep on learning as well. So ongoing professional development is very vital in it as well. For some skills, they're very chaotic and it will be very careful. I mean, I would say maybe pushing someone to the edge of chaos might be okay, but going into the chaotic area will be very dangerous. So these are things we got to be very mindful of when we're trying to expand our scope of practice, which is allowed within the United Kingdom, unlike many other countries where you stay within the remit of physiotherapy. However, in United Kingdom, you can expand your scope and become advanced practitioners and many other things. This is just the picture of what it looks like. So we can say, oh, this is a simple task. It's something that can actually read, follow some protocols, contact some units. Please send your protocol for us, have a chat with them. And it's just simple thing. You probably don't need to go for, for the training. But for some complicated, which will be here. So the level of agreement, that means that your manager will assess you. They probably have a view and understanding what you can actually do. You have an understanding what you can actually do. So a kind of agreement will be there. Yeah, this is quite good. So you're moving close to a level of agreement. So the more you move there, then that level of assurance that that task can actually be done will be quite easy. And the certainty that it evolves is very close, to zero. Then it shows that it's highly predictable as well. So it's simple tasks or skill to acquire. But start moving upward, it becomes, moving far away from certainty and moving away from level of agreement. Let's say your manager say you should go and learn new things, and you said, no, I think this is going to be too much for me. And that is no agreement, then that's going to be a big issue. Or you say you want to achieve this and the people that will support you are not in agreement with it, then it's going to be really difficult for you to move into that, achieving those kind of skills. So it's just for us to be able to be aware that things that you can actually use to assess yourself and situation to move into new level of scope, expanding beyond your levels of scope as well. However, we got to do it within the legal framework, ensure that it's supported within the workplace as well. And more importantly, it is actually incorporated in your job description as well. As healthcare professionals, once we are on job, these are things we've got to be ensuring that we're doing day by day. We've got to ensure that we are clinically effective, our intervention is effective. The service or the provision of what we're doing, we are auditing it. Are we meeting the standards? There's so many standards out there. Are we meeting the standards? So we got to be assessing ourselves in that respect. So it's what we call a clinical audit. Risk management has to take place almost day by day. You can't just say you can do away with risk management. There are other risk management if you got to a level of manager or team leader you got to be involved in, where you got to look at the risk of the environment, the risk of the task, the equipment they want to use. Is it, so many things that goes into it. So these are part of clinical governance to ensure that the service that you're providing is actually safe and is not going to harm your patients. Also, we got to look at the information, the data, your documentation is very important. It's part of HCPC, standard. You need to be able to document, and this is also contributes as well to record keeping. People can actually come back to your record because it's a legal document anyway. Things can happen, and people might recall and say, okay, they want to investigate things. But if you haven't documented properly, then it cannot help to support yourself, defend yourself. So this is one area as well, and not only for yourself, but for other members of your team as well, because when you document, they can actually read what you've written there. You can put your plans there, they know what is next. And if you're not around, they know what is actually next for them to do as well. So this is one thing you got to look at as well. We got to involve our patient, all the stakeholders as well have to be involved. The family, the patient, hearing their feedbacks. And there's what they call like a co-design, co-production these days, where even before you even design or go into new service, you want to involve the patient as well so that they actually involve and they contribute, in the development of the new service you are trying to think about to provide for them, because they are the one that are going to receive the service. Not you receiving, you're delivering the service for them. They are the one that's going to be receiving it. So they need to be having say as well, because you don't know more than, you probably have the knowledge, professional knowledge, but in terms of their own experience as a patient, you probably might not be able to have that. So getting their perspective is very vital. Getting feedback from the patient is very, very important. So you got to be looking at all of this. And if you can demonstrate this in your workplace, I think you'll be distinguishing yourself as a professional among your colleagues. It is what is out there for us to do, but how much of it are we actually practicing as well? The staff management is very important, and looking at the competence of the staff, the mandatory training and all the rest, and ensuring that they actually have the training to deliver the job they're supposed to do. So I will encourage us, we need to be looking at this aspect so that we distinguish ourselves in our place of work. I'm sorry, some people are still having their speaker on. Okay, yeah, I'll move to the next slide now. This one, I think most of us will have heard about KPI. KPI is being, it's called Key Performance of Index indicators. And I think most of the time the commissioner will give it to a service that they've commissioned to be, to provide service to a locality or a kind of environment, a kind of group of patients. So they will have given them the, how to ensure or how they will prove that they are delivering the service up to the standard or up to the level what they want them. So there will be what they call like a service agreement, and some of this information will be included there. So it will be good for you as a profession to be aware of this, not just say, oh, I'm just doing a clinician, just be, being aware of what's going on around you is very vital. But I've turned it around, rather than calling it key person of key performance indicators, I've turned it to be key persons of, of influence. Let us look at self, the place where you work in, how credible, how can you do, what can you do to develop yourself, to build up a good credibility for yourself, develop and build a good reputation for yourself in your workplace, making positive contribution, being reliable and be committed to the work. The other thing is networking, collaborating with other people, because you're not going, you'll be surprised that things will happen. Somebody will mention of you, or if you're looking for someone, we can count on this guy, can actually do it because of the fact that you've networked with other people. And there's a saying that your geographical location will determine your opportunity as well. You know, if people have not met you, it will be difficult for them to be able to talk good things of what you're capable of doing. So getting out there is really important. Being a leader doesn't mean that you got to be the leader of the team, but there's some situation where you can be what they call like a situational leader, where something arises and you step in and you be the one that's actually helping out. And having this innovative mind as well is very important, because you can come up with new ideas, suggestions to improve the service where you're working. And that can actually have impact and ensure that anything you're doing is aligned with your organization goal or target as well. And it can actually make contribution and influence others as well, making, you know, working towards ensuring that the growth or the objectives that they've been setting or that's been set up, you're working towards it, and probably partnering with other services in your areas. You are making yourself known gradually as well. Like I mentioned earlier on, it's really important to plan our own development. You're not just going to work. Work is one place, but it's provide our opportunity for us to develop ourselves. If we just go in there to say, yeah, I'm just going there to do the work, to see the patient, and that's just it, it will be really difficult to get that opportunity to develop yourself. Like I said as well, before even looking at the job, even if you go for an interview, you probably can ask them questions. What have you got for us? What is in place to support me? You know, do you have this? Do you have this in place? And that will help you. Oh, the place I'm going, can I just leave? Is it possible for me to live where I am right now before moving to the next place? What they promise, are they able to deliver? Or they said, no, we haven't got this thing in place. And if they say they haven't got it in place, is there any other strategies that you have in place to actually be able to help you to achieve your own goal? Because you're working at the same time, you're moving and developing yourself as well. So you got to be looking at preceptorship. That is for new staff that's just joined. Look at preceptorship. Do they have anything to help you in the process at the first stage of just joining that organization? And that will help you in your integration, in your transition into your new role, more especially as an international practitioner. This will help to ease your journey, your integration into that system. That's what they call a clinical supervision. You can ask for it. Professional supervision is all there that we can actually make a demand for it. When you have your one-to-one, rather than just leaving it, you'll be more proactive and bringing this forward to your managers and saying this and this, you've heard about it. How can I, you know, gain from this kind of support in my job as well? Mentorship are there. Appraisal will be one of the ways that you can actually put it into writing, which will be a kind of agreement. Your manager will agree to it. And if they agree to it and you're not achieving it, then you can always say to them, you're not being supported to achieve what you've actually set down for yourself. But if you've got nothing written down, it's going to be difficult for you to be able to say you're not being supported as well. Not just at your work, because they will ensure that you have the resources, you have the equipment to do your job. That's their job, to ensure that you have those things in place for you to do your job. However, if you say your objective there, that you want to do this, you want to do that, then it's much easier for them to, when you're having discussion, your one-to-one, you can always bring up your issues. I've not been able to achieve this. These are the difficulties I'm having. You know, these are issues I'm having. I need your support in this area, and that will help and make your work and your life much easier in your role as well. So these are areas I would say, look at the clinical skill when you're doing your appraisal. Look at management and leadership skills that you can develop as well. Put it in that objective. Don't let the manager say, oh, this is what I want you to do. But before coming for the meeting, you have prepared yourself and come up with things. But very importantly, ensure that your goals is in alignment with your organization goals as well, objectives and their values. Because if it's totally, not in alignment, then it'll be difficult for them to support you. Because when they know that you are achieving that goals, then you'll be helping the organization to achieve their goals as well. So it'll be quite easy for them to support you. Like I mentioned, clinical supervision, this is more focused on the supervision of your clinical skill, especially for less experienced staff. Let's say somebody's just band 5, they're coming into a new place, they need to improve on their skills, they need to develop new skills, then this is one of the ways to get it done. And this has to be, structured into your work as well. So you have the opportunity to say, oh, yeah, I'm having supervision, clinical supervision with my senior, and that will help you in your own development. But if you are left to your own devices, you will do it because there are other ways to achieve it, but it's going to be more, more of effort, more of strain, more of challenge for you to be able to achieve it. But having that support in place, then it makes life much easier for you. And like I said, it's going to be focusing more on your clinical work. And it will be looking at developing your competency, looking at developing your effectiveness at work as well. And sometimes it will look at emotional well-being if it's related to your clinical work. So that is that on, what's it called, the clinical supervision. And the next thing I will just mention briefly, professional supervision. This we talk about not only your clinical work, but looks at so many other things like your career goals, your growth as a person, coming with identifying development opportunities. So you've got to identify people that can actually help you within your organization to do this for you. And you can mention it during your one-to-one. You're looking into professional supervision and you're looking for people that can actually mentor you, help you to go through this. And they can actually help you to navigate through some professional challenges as well. So this is one of the areas I would say. And forum is very, 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 very important, especially for foreign trained professional if you come into a new system. And a study is actually proving that it helps to increase access to information. It gives that network there, professional network. You have opportunity to speak to other people, open up to people that can help you, and you get that support as well. It gives opportunity to have, peer-to-peer learnings like we're doing now. I know this is not clinical work, but we're just talking about things general, about work general. And it probably gives opportunity to do like a self-reflection as well. And you probably will learn from people as well, people's experience. This I just want to share with us as well. These are few of resources that you can actually tap into in your development. We have clinical knowledge summaries, which is put out there by NICE guidelines, not by NICE, and it covers every condition you can ever think of. So you can go into it and find any particular condition you're not really sure, and you're very sure that when you've gone through this document online, you're sure that it is in line with what is actually obtainable in United Kingdom. The other resources which I find really useful when I first joined the NHS is the interactive CSP forum. You have people discussing about different things, about clinical things that you can learn from. Another learning resources. So another resources that we recommend is what they call e-learning for healthcare. This is free for all healthcare professionals. And I think for NHS staff, it's free. You can learn so many things on this platform and you'll be given certificates. There's so many courses you can do there on conflict resolution, on management, on leadership, on clinical work as well. So you can learn so many things as well there. Another thing is that this is a Orion education. They provide webinars online now, but before they do, they're doing online. I think there was a time I had to travel to where they're doing their courses. And these courses are being organized by consultants, and they're very, very affordable, something about £30, £35. So with internet and with technology now, you can actually access them more easily. So there will be other ways you can actually look at to get yourself going. And for people that are looking at leadership development, this is a resource on NHS Leadership Academy. They actually have a framework that will help you to look at different domains that you have to be looking at in your own development. And this is the end of the presentation. And I don't know if anybody have any questions. I'll be happy to answer. If not, I will ask my colleague or other senior colleague that might be on the platform to help us to answer your questions as well. So thank you very much for taking the time to listen to this webinar. Thank you.
Thank you very much, Mr. Aligwabu. I mean, I find it quite interesting in the revelations, including the things around the imposter syndrome and how much linguistics and cultural elements of life and everything, comparison with others in the workplace, how much this can all interact in a way to impact on performance, especially by people migrating to practice in new settings. And I think I'm also looking at, I find it interesting the way you've drawn the relationship between roles of independent practitioners and how it comes with actually challenges. I think I just want to draw a point. The study you've shared with us here by Stevens et al., 20%, in how availability of forum similar to this, our own, can actually enhance how we settle down and overall how we perform in our roles. And I think I thank you very much for taking on this first seminar of the organization. And I think it's really an opportunity to say, I think it's a good thing happening, and we look forward to many more opportunities of this kind of seminar and presentation like from individuals like yourself. Thank you very much.
You're welcome. I think that, I don't know, there's some probably question going into the chat. Let me show you this question or not. Oh, thank you, thank you, thank you. Thank you all for appreciation. Really, thank you all. All right, yeah, we can share the screen. What's it called? The slide. There's no problem with that. That can be shared with people. That's no problem at all. But what I will do, I will send it to the host so that people can contact him, because I don't have anyone's contact. So anyone that needs the slides can actually contact Dr. Ademola Adekunle. Thank you.
Please, I think there's someone indicating they want to. Abdulwasiu Lawal, please. I could see a hand up. I think you just need to unmute yourself. Thank you.
All right. Can you hear me?
Yeah, we can hear you.
Good evening, Doctor. Good evening, the host. Thank you very much for this wonderful presentation. And I really enjoyed the presentation. Thank you very much for that. I am Abdulwasiu Lawal, just about to graduate from the university, Bayero University, Kano, here in the northern part of Nigeria. So I'm happy to, when I saw this invitation, it was actually shared to me by my lecturer, and I believe I actually need it, because for the graduates that are just leaving the institution, it is the kind of knowledge that we need so that we can know what we are getting into, especially as we are moving into the labor force here in Nigeria, and also those that consider traveling abroad. So despite the fact that most part of the presentation is very, very interesting, but I'm actually going to ask what is related to mine, because most of the things you mentioned, I believe those that are practicing abroad will be able to understand better. Even though for some of the students here, they believe, it's that easy to just go abroad and we start practicing and all sorts of things like that. However, you have widened my own knowledge regarding that. So we now know that there are some challenges that I encountered over there and how to tackle those challenges effectively. So, sir, my question is this, actually, what advice are you going to give to someone like me, someone who is about to graduate, maybe in the next few weeks? You know, here in Nigeria, we go into internship after our graduation, then service here and all that. And what we are hearing from most people is, okay, try to go abroad, try to do this, try to do that. But from what you have mentioned, it seems there are some required years of experience that one needs to make sure they enroll in here in Nigeria before traveling abroad. So here is my question. Do you advise that after our internship or maybe service, then we start looking for a way to apply abroad? Or we can actually stay behind and gather some more experiences regarding skills, or even those that want to move into the academic environment? So which do you advise? Do you say that we should kind of spend some time here to gather those knowledge, or we can just say, okay, now I'll finish my internship, let me quickly run on how to travel abroad? So what do you advise? Thank you very much, sir.
Okay, thank you very much, Abdul Wasil, for the question. I think it will be really difficult to say there's a straightforward answer to the question you've just asked. However, you've got to sit down and look at what you want to achieve. You understand? We have a situation, I've seen people actually left Nigeria. I think they probably did their only internship. They didn't do even their national service, and they came to United Kingdom and they're practicing already. You understand? It all depends. If there's opportunity for you, let's say you've done an interview, like the survey that I actually pull out from CSP. One of the things that we mentioned, and the highest number of the reason why people find it difficult getting their first job, is the fact that they haven't got the UK experience. You understand? If you got the opportunity, you apply and somebody offers you the job, my brother, I would say take it. Because that, if you can follow what we've discussed today, you will find it much easier for you to get into the system. You got to be more proactive on it. You understand? If you get the job as a, let's say, even as an intern, and you look at your situation, your personal circumstances, you got to look at it as well. You know, there are other things might be going in your own life, but if you say, this is what I need to do, I want to travel out, there's nothing stopping me, then taking that opportunity, I would say, I will grab it if I were to be in your position. Then I will make sure that when I come in, I'll be asking for preceptorship. Like in my organization where I work, we have preceptorship for Band 5 and all international staff. But if people are not aware of it as well, then they probably will not take advantage of it. You understand? Asking for clinical supervision in your one-to-one will be good. But if you're just leaving it for your manager to do it, then the manager has so many things on their plate as well they have to do. They have that responsibility to help and do things. But if you are coming forward and you're asking preceptorship, I heard that some organizations are offering for their staff. Is there any way for me to access this? Each organization have their own training and education and training department. You can be in touch with those departments as well. Ask for what is actually available in terms of preceptorship. So they will be able to put you through as well. But if we sit back, you understand, then that opportunity will evade you, then you probably will find it and struggle. But this system is not a system that makes you to struggle, but if you stay back, then there's a chance you struggle with it. Those facilities are there. It's not left for you to take advantage of it. So like I said, preceptorship, make sure you take advantage of it. Ask for your, what's it called, appraisal. In your appraisal, don't leave it for your manager. Your manager will contribute in it. They will want to ensure that their own service objective shows up, shows up in your appraisal. So that, because when you're achieving your own objective, then the service of the unit's objectives will be achieved. Their own manager as well will be saying, oh, they're making progress, you understand? So you've got to come up with something that is in alignment with those things as well. So that's why I say it's really important to be aware of the KPI as well of your department. So you can always, I'll give an instance now. Like I've gone for field trainings in my organization, and when I'm trying to apply, like I work in an inpatient, and people do musculoskeletal, and actually went for Society of Musculoskeletal Medicine weekend course. And what I did, I just put it one or two things together. So we do have patients that comes with frozen shoulder as elderly. We have patients that got fractured. Me having this kind of knowledge will actually enhance, the service. And I just tied to the length of stay. I said, patient needs to be more functional. If they can't use the upper limb, it will limit their ability to regain their function. It's just putting two things together and just put it together. Then it will be really difficult for anybody not to help you to do it. And you have a cause then to say your manager is supporting you or not as well. If it's written down, it's quite easy to say, I'm not being supported. I'm not saying you're using it to say, because if you're not supported, if you say you're not supported, the people will ask you in what way. So you don't just say, I'm not being supported. You got to be more specific as well when you say, I want to be supported a bit more. These are things that I need help with. These are things that are in the way, and hopefully those will help you. So back to your question, if I get the opportunity, even if I'm just finishing university today, and I've got my license today in United Kingdom to practice, and I'm giving an offer, I will take it. The only thing is that, are you coming back to Nigeria to say, I'm coming back to politics? Then that's another issue for you. There's so many factors you got to look at as well. Your NYSC certificate, you can come back and work in it, with the government. So that's my answer to the question.
Thank you.
I hope
very
I've
much,
answered
sir.
your question.
Yes,
I'll answer your question.
You have, sir. Thank you very much. Really appreciate it.
Thank you.
Hello. 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 Can you hear me? Yeah. Hello. Can you hear me? I want to ask a question. Hello. Can you hear me? Hello.
Yes. Yes,
Yeah.
you can.
Yeah. My question is, first and foremost, how do we join this Nigerian Physiotherapy United Kingdom group? And well, let me start by appreciating you for gathering this Weber meeting. I'm very happy. And my second question goes like this. You said we should ask for appraisal or supervision, which is good. Like what likely should we be expecting for, what kind of things should we be expecting during appraisal? For supervision, I know, yes, they have clinical supervision and they have non-clinical supervision. I think the clinical one is where they want to know how you communicate with patients, how you interact, and how you carry out your analysis and your plan. I think I understand that very well. Then non-clinical should be about your well-being in general. But my question now is the appraisal, when should we ask, where should we ask for it? Is it after 6 months in entering the organization or after a year? And what likely are we expecting from the appraisal? Thank you.
Sorry, Mr. Ribabu, I think you are mute.
Mommy? Oh, sorry.
Thank you.
So
and please, can the rest of us just mute, please, so that we avoid the background noise? Thank you.
So in terms of the question regarding the appraisal, like I said, in any organization, even in a private organization, you'll be given appraisal, and it's just to assess your performance. And what I'm trying to say now is, when you are working in any organization, it's good for you to know what you're going to be assessed with at the end of the year, because it's an annual thing. Maybe when you just first join a new post, or you just go into a new post or a new role, it might not happen straight away. Well, I would say between 3 months, you should be thinking, or your manager should be thinking of setting an objective for you. You understand? And that will be what they're going to be using to assess you eventually. There are two parts to it. There's what we call, I don't know, it might be different. Let me just make it that clear. It might be different from one organization to another. But from my own experience, your appraisal will be divided into two parts. The first part will be your performance on your job. You understand? They want to make sure that you're meeting some, like we mentioned about key performance earlier on. So there's some things that you've got to be able to achieve. You understand? And that will be part of your performance, your objective, your performance objective. The second part of it will be your personal plan development. So if you say, let's say, I want to be able to offer quality neurological intervention to my patients and to acquire a skill in Bobat concept, then it will come when you come to your personal development plan. Then you can actually put it there that this is my goals, my plan for my development to help me to develop that skills, to be able to develop and deliver what I've actually mentioned in my performance objective. I'm just using that as just one example. So you can link your, or let's say even your manager actually put some objective there for you in your performance objective. You can go ahead and look for something that can be linked to that objective. So it's left for you to be able to be more, innovative on how to go about it. So after a year from the time you have your first appraisal, then they will come back to assess you. So yeah, you've been able to achieve all we've set out for you, then you're good. I think everybody will be happy, you'll be happy. And at the same time, you're developing yourself as well. So I would say if you're starting a new job, probably within 3 months, you should be having something along that line of setting your objectives, your appraisal done. And a year after that, then that can be reviewed. I hope I've been able to answer your question.
Sorry, are you saying that, are you saying now that after the first appraisal, which is 1 year, then maybe like, is it 6 months, or the next one, will it be 6 months or still yearly?
Okay.
And
okay, let me just quickly answer that first question then before you go ahead. I think, yeah, when you're talking about appraisal, I mean, I probably might not go into details of everything, but when you're doing the appraisal, there's what we call like a midway appraisal as well. You understand? 6 months from the time you've done your appraisal, you do like a midway assessment. So it's just to check the progression. And the good thing about it as well is that you don't want to wait till the time you get to the final appraisal and you say, oh, these are the issues I've got, that the reason why I can achieve this. Can you get my point there? So you have the initial one, and I will even say, don't wait till the time you have your midway appraisal. You can actually be bringing it up in your one-to-one. Your one-to-one is to discover everything about your work. So including your objective in your appraisal, if you're having any challenges, or they say there's no funding, or there's a funding, but there's no time for you to go for this training because that we can't give you a study leave, then those are the things you got to be discussing in your one-to-one. So your one-to-one give you that opportunity to be discussing the issues that is cropping up before you even get to your midway appraisal. You understand? So midway appraisal will focus mainly on your appraisal, but it gives you opportunity to discuss about the progress and the challenges you're having. I hope I've been able to answer your question.
Yes, you have, but my other question, because you said something about we should maybe like ask our supervisor or our land manager to give us like an objective concerning our personal plan development. Sorry.
You're probably making, what I'm saying is this, you can come up with your own objectives. That's your own part. And you got to be proactive from your own end. So you come with your own objective. However, your manager will come with an objective, because your manager has a manager as well, and they have a manager up to the directors. So there's a strategic, planning from the top, which will be cascaded down. So your manager will ensure that whatever plan, objective, or performance, whatever that they've been set for them, is passed down, because they have to delegate as well. They're not going to be the one doing the job. They are the manager. They've got to manage to ensure those activities being done. So some of those things might be showing up in your own appraisal. Can you get my point there?
Okay.
Yes, I do. Because I was thinking that if you ask now, maybe like now you set up an objective or you set up an appraisal, personal objective, and you don't meet up, that they might use it against you. That's what I was thinking under appraisal. So sometimes I don't say anything. I would prefer them making their own decision. But you now you are advising that we should be proactive, get our own objective, right? If I got you well.
I would say I'm saying it because that is the way I plan my own life. You understand? Because I don't want anybody to plan for me. And all the like I've been able to do so many things being sponsored. I don't use my money. I'm not saying don't want to use your money, but I use my money to do other courses as well. Like I do go to some other courses, like mentioned a few things during the presentation as well. And I joined some, what do they call them now? Special interest group as well with CSP, that they offer some courses as well. So there's some things you will go for as well. But when it comes to other things, there's some monies, there's some funding within the organization. But if you're not taking advantage of it, it will be really difficult for you to develop yourself. So you're looking at the way you develop yourself. And in life, you got to set goals for yourself. So you set goals, and your goal is to achieve your goal as well. So if we don't set goal for ourselves, then it will be really difficult for us to move. So you got to set goal for yours, and you got to ensure that you set something achievable. You don't want to set yourself for failure. Can you get my point there? Not saying you want to achieve something. Like
yes,
when I'm
I am.
supervision, I will say, oh, you say you want to do this, I'll just tell you, oh, this probably would be difficult. I'm just taking from my own experience. So I'll be sharing with you as well. If it's a good manager, you might say, okay, this probably would be difficult for you. But if there's another way to do it, then we've got to support you as well to do it. So your manager will support you to do it, but you've got to do it yourself. And also, you got to be looking at resources when you're thinking. I think this is, I think we're actually going out of what we're talking about now, but we're going into more of the appraisal now. When you're setting your objective, you got to look at the resources as well. What are the resources that I can tap into that will help me to achieve my goal? It's not just setting the goals, but you got to look at what are the things available that will help me once I want to do this. What do I have within there? We have people within the team that are ready and willing to help me to develop some skills. You understand? So while you're considering the objectives, you don't want to set yourself up for failure because you're going to be assessed against it. So you want to set some objectives that are achievable, but at the same time, you look for and make sure that there are resources that will help you to achieve those things as well. So you might do like a SWOT analysis, SWOT analysis yourself. Okay, what are the opportunities? What are the threats? What are the obstacles that will make it more difficult for me to achieve this? And you weigh things out and say, oh, this will be a difficult thing. But if your manager has just dropped it on top of you, then, and you just accept it as well, and you haven't considered what are the resources that are there to help you to achieve, then that's the problem, I would say.
Thank you very much, Mr. Adigwabu, for the wealth of insights you've shared with us. I mean, this attests to the breadth of your knowledge and practice, clinical academics and the rest. Please, because of time, I think we've gone beyond what we planned. We started a bit late and then we had a bit of interruptions, but we will need to round up so that we can all go back to other things. But I know you've mentioned quite a lot around different aspects of practice. And I know quite well your wealth of experience in the private practice as well. Is there anything you want to, throw in from that angle of things in rounding up?
Uh,
Thank you very much.
I would say, um, in terms of, what I would say when it comes to practice outside, one thing I would say is that you got to be very careful of what they call it conflict of interest. I would advise people to be aware of that. So you don't want to do things that will be in conflict of interest with your organization because that might put you into trouble. So it's very, very important to look into that aspect before you do anything. However, my thing is that I get involved in so many things in terms of my clinical. Please, let me just take this question. I think Odogu wanted to ask a question before, but he's dropped his hand now. Odogu, can you ask a question, please? If I would not spend too much time, if it's going to be too much, then we can arrange extra, maybe through.
Please, the question is how do we join this UK Nigerian how do we join Nigerian Physiotherapy UK to support each other?
Okay, I think Dr. Adekule will put it in the group.
Yes, and the second one is concerning agency. I wanted to get more advice concerning agency, working with NHS, and also maybe partnership in agency or what they call it, private clinic.
It will be difficult for me to give any advice regarding that. I would say go back, read, if you're working with an organization, read their policy, understand? Read their policy very well so that there's no conflict of interest, you understand? So ensure that you read that policy very well before you engage. But the practice I actually do is, I think the few things I did, which is actually outside the country, I set up a website, and through the website, people are able to contact through the website to access for physiotherapy services. And what I've been doing, sometimes I'll be able to do like telehealth with some of the, at the client. And some of that time, the kind of setting we work in Nigeria, people want face-to-face. So in that situation, I will refer that client to people on ground in Nigeria who I trust to be able to do the job. So that's what I've done. And funny enough, I didn't even know. It's something that last year, the service was actually nominated for the kind of what they call it, Nigerian Healthcare Excellence Award in the category of physiotherapy. So I was a bit shocked that how did that happen? I didn't even know anything about it as well. So I think what we got to look at is that we shouldn't limit ourselves as well. There's some people that probably want to go into that full time. There's opportunity there as well. I've got a situation where people contacted, there was a time that even Danish embassy, but there's no way I will be able to do that, contacted me. You understand? So there's a lot of opportunity, even in Nigeria, there's a lot of opportunity there. You understand? So it's just for us to be able to see how we're learning, what things that we can actually tap into and move things forward as well for ourselves. And that's just one. The other organization that actually was asking, oh, can you organize a wellness program for us? I'm actually not around. You understand? So those are the other things that you can actually look at. And I think you can gain and you can expand your scope and you can practice using technology as well. So that would be what I can say in the area of private practice. But if you want to do a private practice in United Kingdom, be very mindful of conflict of interest and read the policy of your organization before you engage in it.
And please, just to maybe if I can in any way explain more what you mean by conflict of interest, because partly is looking at where we come from, it's not uncommon the patient within the same hospital approaching you and then you taking on the patient. Whereas here, you can't really do that. And I think that's what Mr. Ribabu is stressing about conflict of interest, so that you have to see a patient to whom you are not ordinarily obliged by your practice to see under the government payment plan. And doing that can mean you're actually going around the policies. And thank you, sir. I think if we carry on, there are lots of questions people will want to ask, certainly. I will quickly mention the aspect of joining Nigeria Physiotherapist UK. If you're already here in the UK and you are practicing and you are registered with the HCPC, please, you can join us. I will give my number. I'll put it in the chat so that we won't delay our people from joining. Okay? And in case you want to place
Dr. Demola, we can hear you again. I think I might have muted you, Dr. Demola. Yeah.
Okay. Sorry, I don't know when that happened, but I've mentioned briefly that if you want to join the Nigerian Physiotherapist United Kingdom and you're already here in the UK, because that's the inclusion criteria, you need to be practicing in the UK and you need to be registered with ACPC. Obviously, you have to practice. And then other things we can always discuss. I'll put my number in the chat. For people who are already here in the UK, you can contact me. We have the steering group, a number of us in that steering group, and then we have the bigger platform. You'll be added to the platform, and I'm sure that will help in addressing some of the questions our people are asking here. I just don't want us to stay longer in terms of the time, and I think we have to say thank you for your patience. Is that okay? Thank you very much.
Thank you much, everybody. I'm sorry.
Yes, please.
No, I just want to thank everybody for coming for the first seminar organized by the group, and I hope many more will be coming. Thank the group, that's Nigerian Physiotherapists in UK, for inviting me to share the little I know. So thank you.
Thank you, sir. Okay, thank you, everybody. And wherever you are in the part of the world, wish you a good day. I will say good night if you are here in the UK, but we know some people have joined us from the various other places. Thank you. Bye-bye.
Thank you. Bye-bye.